Hi, Dr. Rhiannon here. Welcome to the first part of my early postpartum rehab series. I am a pelvic floor physical therapist and I work with patients who are pregnant and postpartum all throughout that span. And today we are going to be talking about early postpartum. So there's a lot of confusion about what we can and can't do really early on. And I call this phase one because this is really the foundations of where to start. And for some people, they could do this potentially even as early as that first couple weeks. And other people, they're going to be starting this, much later. And it doesn't matter where you are as long as you're starting with this great foundation to get your body moving again, get your breath work working again, getting those muscles turning on the way they should after that huge transition of giving birth. So let's get started. We're gonna start on our backs. So I'll have you lay on your back, knees are gonna be bent, and we're gonna put hands on our lower rib cage. So rib cage is a big one that I work on a lot postpartum because of how stiff it gets. Because baby gets bigger and our rib cage kind of gets pushed out of the way, and it can cause a lot of stiffness. And then it makes us breathe differently. It makes our core activate a little bit differently. So we're gonna start here. Hands are gonna be on lower rib cage. We're gonna start with an inhale. Feel the rib cage expand, and an exhale through pursed lips. Feel that rib cage kind of come back in. So it's an inhale. Feeling everything expand, exhale. Feeling it come inward. So try a few like this of just practicing that inhale, rib cage kind of moves outward, exhale, and it comes back inward towards your center. Once you've got a handle on that, we're gonna add in a little bit more of an active piece to this. So it's still the same inhale, it'll be inhale, expand. But this time we're gonna exhale and actively kind of draw the rib cage inward, draw the lower abs inward, kind of towards our center on that exhale. So it's an inhale, get some good expansion, exhale. Now we're actively pulling those muscles kind of inward as we exhale through pursed lips. Sometimes people like to think of smelling the roses and blowing out the birthday candles as ways to remember how to do this breath. Let's do one or two more here. Now, if you want to, take a little breather if you need to. Sometimes doing those deep breaths, we can get a little lightheaded, so take a little breather there. Another piece you can add to this, and especially if you're doing this for, the second or third time, once you've kind of got a handle on the core part of it, we can actually start activating the pelvic floor and doing a little bit of a Kegel as we're pulling inward. So we think of with this breath work that we're inhaling, everything expands, even pelvic floor expands a little bit, and then as we exhale, everything's pulling in towards center. Our core is pulling inward, our rib cage is kind of coming inward with those obliques, and pelvic floor can lift a little bit on this exhale too. It can be really gentle, it doesn't have to be anything major. In fact, I don't want you doing like 100% squeeze with this Kegel here. Kegel, pelvic floor contraction, you'll hear me use those words interchangeably. They are the same thing. So let's try a few like that. So it's an inhale, we expand through rib cage, maybe a little expansion through pelvic floor, and then exhale, drawing in my lower core, and maybe I'm drawing my pelvic floor up and in a little bit. And let's do that again. Good, and keep practicing this one a few more times. If you were like, this is very confusing and your body's not quite listening to what you want it to do right now, totally okay to just stick with the ribcage breathing and just work on the ribcage movement out and in. No problem, it's a great place to start. Good. Now we're gonna move on to the second exercise in the series, which is the pelvic tilt. We wanna start getting that pelvis moving a little bit. So you're gonna see my hands on my hips here, and what this looks like is I'm gonna tuck my tailbone under like this, let my back flatten out a little bit more towards the floor, And then I'm going to shift my pelvis the opposite direction, so my tailbone's kind of towards the floor, and maybe I get a little bit of space underneath my back here. And we're just gonna rock back and forth gently here. You may start with a really small movement here. That is totally okay. We're just starting to get some of the tissues moving, starting to work on getting some blood flow into that pelvis and the hips. Oftentimes it can be really sore after birth, whether you had a C-section or a vaginal birth. We still, both of them affect our pelvis, our pelvic floor, and our core. In a little bit different ways, but they both do affect all of those things. So we're gonna just keep kind of rocking back and forth here. You might find that you start out doing like a really small movement and then gradually feel like it bigger and bigger as you're more comfortable. And with all of these things too, like they should be pain-free. So if you're having pain with these, give it a pause and maybe give yourself some rest. Maybe talk to your OB, your midwife, or your pelvic floor physical therapist. Good. Okay, awesome. So we're gonna come back here, give those hips a little rest, and we're gonna start working through another rib cage movement. So this one, I'm gonna have you roll onto your side for, and we're gonna tuck those knees up. So I've got about a 90-degree angle at my hips and my knees, more or less. And I've got my hands and arms straight out in front. You might want a pillow here. I'm gonna kind of hold my head up, or you can rest it down, either way. And so this one is great if you are breastfeeding or just holding a baby a lot. We get a lot of stiffness through our rib cage and through our chest. So we're gonna take this top arm, we're gonna open it to the other side, and then we're gonna bring it back. Good, and we're gonna reach it up. We're just gonna go through this motion a few times here. You can go as slow as you need to. I generally start this one out as kind of a movement and not as much of a hold at first, just to get things moving here. And then we are going to do a little bit of a hold on the last one. Got one more here, and making sure we're really like rotating. So we're opening through the chest, but I'm also allowing my upper back to rotate. And then this last one, we're just gonna hold. And maybe we take a few breaths here. Might feel really tight, that's okay. A few deep breaths. You'll feel most of this breath on that, whatever side of your rib cage is upper here. Some good expansion on the inhale, and then exhale, relax. 2 more breaths. Good, last one. Super. Let's bring that arm back, and we're gonna switch sides. So you can just roll over. I'm gonna flip-flop, just so you guys can see me still. And same thing, knees are tucked up, hands in front. And we're gonna rotate. So reaching that up and over, really letting your upper back rotate, chest open. Good. Now eventually, you might be able to get this hand to the floor, and you might not. But for now, if you have a lot of tension in the chest and in the rib cage, we do not by any means need to be able to get there. We're just kind of working towards that motion. So I'm doing about 5 of these and then holding the last one. So I think we've got 2 more. Just kind of this nice, gentle movement. And last one here. We're opening and we're holding this last one for a few breaths. Inhaling into this top rib cage here. Exhale, relax into the pose. Inhale and exhale. 2 more breaths on your own. Good, and we're coming back. Awesome. All right, one more exercise here. We are gonna come onto all fours for this one. So here we are. If you have any pain in your wrists, you can come up onto your fists here. I also sometimes will have people put a dumbbell and just hold on to the dumbbell. Can help keep the wrist a little bit more neutral. If not, we'll be here. And this one, we're gonna work on that rib cage and core again. So thinking about this time, a 360-degree expansion through the rib cage on this inhale. So it looks like this. I'm letting my belly kind of relax down. I'm letting my rib cage come out, and then exhale. I'm drawing all of this inward back towards my center. So it's an inhale and exhale. Good, so inhale, expanding all the way around. Again, letting that belly be nice and soft here. And then exhale, drawing belly up and in, drawing that rib cage in, everything in towards center. And repeat. If you want to, especially if you've done this video before, you can add the Kegel in here too. So it's an inhale. Maybe we expand a little bit. I can feel an opening through that pelvic floor. And on the exhale, as we draw our core in, maybe we do a little lift through the pelvic floor. Trying to keep a nice neutral spine with this too. A lot of times postpartum, we tend to have a little bit more of what's called an increased lumbar lordosis, just because of the weight of the baby throughout pregnancy kind of pulls us here. So most of the time, we're kind of coming into a little bit more of an alignment and nice flat back here. Good, one more of these. All right, great. And we'll come back to sitting. So those are the foundation of the exercises for your early postpartum rehab. We're working on rib cage mobility, we're working on core, we're working on maybe even adding a little bit of some pelvic floor in with this too. Starting gentle, it's really important that we start with these and then we build upon them. Because oftentimes what happens is we end up not moving a lot during the early postpartum period, and then we end up getting cleared by OB or midwife and jumping into things too fast. So my goal of this is to help you bridge that, that gap between early postpartum and you getting back into your activity. So this is the foundation. We're kind of reteaching our muscles how to work again. And then in the next phases, in the next videos in the series, we're gonna build upon this. So take these concepts, feel free to do this video multiple times. This is meant to be done over a period of at least a couple weeks of just really getting the hang of this. And then we're gonna add in another layer to this. Add it in a little bit like harder movements, a little bit more intense, and then slowly build upon this to help you regain your core, your pelvic floor, and just feel a lot more stable and strong in your body. So thank you so much for watching my video. Be sure to like and follow, and we'll see you in the next one.